Okay, today my health issue that I'm going to talk about will be HIV. HIV is a virus that attacks the human immune system. There is no cure for HIV. Unlike some other viruses, such as the common cold, HIV cannot be cleared from the body. However, there are treatments available. You should talk to your healthcare provider to get that information. Now, how is HIV transmitted? HIV is transmitted through contact with certain body fluids such as semen, vaginal or anal fluids, breast milk, and blood. Contact with these body fluids can occur during unprotected sex and when sharing needles or other items with body fluids on them. A mother can pass HIV to their babies during pregnancy, birth, and breastfeeding. But you cannot transmit HIV through sweat, tears, saliva, bath, or being in the same pool with someone that is infected with HIV, or by sharing dishes, drinking glasses, hugging, or shaking hands. Now, who does HIV/AIDS affect? HIV seriously affects the immune system, and it leaves it open to infections from numerous sources. People with HIV can develop cancer, like the cervical cancer, cancer of the rectum. HIV affects the brain, kidney, heart, and other organs. And also any human being. It doesn't have a name, face, color. Anyone who is having unprotected sex or sharing needles or things in that nature can catch HIV. HIV is most severe in South Africa. Over 10% of all people living with HIV/AIDS reside within the region. Adult HIV prevalence exceeds 20%, while an additional six countries report adult HIV prevalence of at least 10% outside of Africa. The highest prevalence rate is found in the Bahamas. The HIV, which causes AIDS, varies in prevalence from nation to nation. Okay, now we will discuss the environmental factor. In recent years, environmental awareness have received a great deal of public attention. However, the emphasis has been put on the influence of environmental factors, weather, personal attitudes, policies, physical structures, transportation, and so on. On the quality of life of a person infected with HIV, the goal of the study was to assess the effect of selected environmental factors on the quality of life of a person infected by HIV. Okay, behavioral factors. It attempts to slow the HIV epidemic worldwide have led to a clear understanding that the battle is simply about using condoms or adherence to medication. Rather, HIV risk and AIDS care involve complex behavior influence from multiple levels, from an individual knowledge, attitude, emotion, and risk perception. The power dynamics between partners, accessible service, economic inequalities, criminalization and vulnerable groups. Economically, people living with AIDS will not only be able to work, but will also require significant medical care. The forecast that will probably cause a collapse of babies in societies and countries with significant AIDS population. Political. Given that there is no cure for AIDS, the extension of treatment those who are HIV positive is perhaps a deeper responsibility than people realize. Donors assume more responsibility to extend therapy and a reminder of those people's lives. Ethical issues. HIV and AIDS raise a number of important ethical issues and problems for general practitioners. The ethical issues impinge most directly on the personal relationship between patients and practitioner, or duty to care, consent, and confidentiality. Oh, Jesus. Okay. HIV in the future, I just feel like there's no cure for HIV. It, as long as a person is taking care of themselves and taking their medication, everything will be okay. Today, nearly 21 million people in the world receive life-saving therapy, which can reduce the amount of the virus in the blood to undetectable levels. To aim that no child will be born with HIV and everybody already affected will be treated with medicines that give the best opportunity for healthy living. So that is all I have on HIV.